Electronic health records, friend or foe? Electronic health records are being touted as one solution to the many problems that plague the United States healthcare system. EHRs are reported to improve patient care, increase productivity, improve workflow processes, and reduce healthcare costs. Due to these supposed gains associated with EHRs, they are being pushed as an essential component to quality healthcare. However, can these aims really be achieved, or are these benefits just a myth? As EHRs are becoming more prevalent in healthcare organizations, so is the literature citing their downsides. While these unintended consequences may not be inherent in the use of an EHR, it is worth evaluating them, if only to help an organization prepare for all possible contingencies. This presentation will look at the 4 selling points of an electronic health record as addressed as unintended consequences in 3 articles examining their use in different healthcare settings. In the first article, it reported that patient care declined under the use of an EHR. After implementing a CPOE, or Computerized Physician Order Entry System, the mortality rate increased in the ICU at a children's hospital. The mortality rate was 2.8% prior to implementation and increased to 6.57% after the implementation. In addition, bedside care declined due to staff-to-patient ratios declining as a result of clinical staff needing to spend increased time entering and approving data in the computer system for prescription and other orders to be processed. The second myth of increased productivity was also disproved, as productivity was shown to decrease in an ambulatory care setting. The use of an EHR increased the documentation time among physicians by about 17%, and the computerized provider order entry system also increased documentation by a whopping 98%. Another article found that workflow processes were impaired through the result of a patient care information system, or PICSIS. A PICSIS can result in 2 types of unintended consequences in workflow processes. Errors in the process of entering and retrieving information were facilitated through identical-looking text, juxtaposition errors, and poor screen layout, all of which created confusion and inaccurate data input. There were also errors in the communication and coordination processes. Data is considered to be linear, clear-cut, and predictable. However, that data can be misrepresented in certain situations like emergencies and transfers of patients. The fourth area of supposed gain under an EHR is related to healthcare costs. However, an article found that these costs increased through the use of EHRs. Having all of your documentation in an electronic database enables the system to scour records for proof justifying greater intensity of services and therefore higher billings. Although the patient may still receive the same care as before, this scouring in EHRs facilitates higher coding levels, and therefore overall healthcare costs are increased without any corresponding increase in quality or level of care provided. Despite the disproving of the 4 supposed gains under EHRs, there were some concerns as to whether these unintended consequences could be carried over to all use of EHRs in the healthcare system. The errors in these articles were often the result of a highly specific failure in design and implementation. And these problems could be addressed through education, improved system design, implementation, and research, resulting in a lower level of unexpected consequences. Design faults of EHRs should decrease as more organizations implement them and work to develop systems that address the best practices already existing in an organization. Overall, these articles showed that technology is not a cure-all in and of itself. However, successful implementation of any EHR system will require the adequate evaluation of the current workflow processes to ensure that the system will fit with the existing best practices. Despite the evidence to the contrary that EHRs may not be the solution that they are believed to be, we do still feel that there are reasons to consider the EHR as your friend. Improvements in medicine, such as developing evidence-based practices, are going to require large databases, and the best way to collect massive amounts of data is going to be through the use of EHR. Transportability of patient health information is going to be essential to reducing system costs, increasing the quality of care, and optimizing access for all. Bottom line, EHRs are going to be a fact of life in healthcare, so we had better be prepared and work hard to reduce the unintended consequences. Thank you.